and not that I shouldn't have heard from you guys, but now that I see you, I mean, I'm just amazed. But anyway, I just want to say I will not be for the whole show because I have another strong appointment coming up there, which I'm already late for. But however, on behalf of the citizens of South Fulton County, I want to thank each and every one of you, and so much for my colleague and my councilwoman, who's responsible for putting this on. Thank you so much. I mean, we've had so much conversation in this area, and more conversation we have, I think the more people learn. To the moderator, I know you're going to do a good job today and get information done. And to these wonderful, talented, young, beautiful participants you have. Give me some young participants. But I wish I could say to hear everything you had to say, but I know it's going to be a great program. And let me close by saying this. It's important that information gets out. It's important that the good information gets out. It's also important that the people who the information that goes to, that they hear, and they hear in a manner in which they understand. I'm sure Carmalitha and I can tell you, and elected officials, we had no idea that we were going to wind up in ourselves in a pandemic, COVID-19. And then when we did it, we started arming ourselves to defend our city and our people against that. And then the issue became, well, I don't want to take it. Haven't you heard about Tuskegee? All these rationales about why we shouldn't take it. But I truly believe now I've taken my first shot, and I'm getting my second shot in 19th of this month. So I'm gonna be 95% armored by that time. So, and I think that everybody should hear you. I hope that everybody listens. I hope the great information gets out. And I think the minds that have been so equipped with not doing it, that you all will change some minds tonight and show people that the best thing to do to get us from under this pandemic is that for each of us to be vaccinated. So once again, thank you all so much. Carmalitha, love you. You're doing a good job. I just want to see what you look like tonight. She looks good all the time. But thank you.
Hang on for just a few more.
Well, it's wonderful. You got your own theme music.
That was nice.
I had nothing to do with that. I had nothing to do with that.
It's wonderful, Carmalitha. And you've been a wonderful council person, and all the best to you. And you guys have a great night tonight. Change the mind.
Thank you.
Thank
you, Mayor. Thank you
all.
Thank you so much. I want to thank everyone for joining. We are live now. So just wanted to kind of tell you a little bit about the reason why I decided to do this event. I am Councilwoman Carmalitha Gumbs of the District 2 for the city of South Fulton. One of the things, and I work in healthcare and I work around seniors on a daily basis. So I just want to make sure I'm clear that I didn't skip the line or anything of that nature. So no vaccine shaming, because I did not do that. But as healthcare professionals, we have to get inoculated. And I chose to get the vaccine. And I had posted a picture of me getting my first shot. And I got a lot of comments, a lot of text messages asking me, why did I do this? No, those type of things. And what it really dawned on was that we still need to educate our community. This pandemic has held me down, and probably many of you, probably for the past year and a half. My life has been completely changed. I love to socialize, but now I'm skeptical at everybody I meet and things of that nature. So it really has changed the way we do life. And I just thought it was important, and even reading the research of actually we're not getting vaccinated. I think it was only 8% of communities of colors that have been vaccinated so far. And in order for us to get out of this, we really have to make the personal decision of whether or not we're going to get vaccinated. So this event is not about vaccine shaming or telling you. It is about encouraging. It's about letting you know the real history behind it, and also to so you're able to make personal decisions. Now, I am one of those very transparent council members. I do want to tell you I received my second shot today, and it has not, not today, yesterday, and it has not been very good for me. I actually have a fever. I have chills and headaches. So I have been struggling all day, but it was very important for me to show up and to let you all know that we have to have a conversation about this. So I just want you all to digest the information, learn from these amazing professionals. If you see the screen, it's just Black excellence all over the screen. So I love it. But it's just important for us to make sure that we're educated. We're going to also do a question and answer. So if you have questions, please make sure you type that information in the live chat. That will be also monitored as well. So now I am going, since the mayor, he just bucked the system and wanted to do his introduction, I'm going to go ahead and turn it over to our moderator, but we will have her bio read by Joy, who has been able to set up this fabulous event for us. I really appreciate it. It looks amazing. So I'm going to turn my camera off so you all can see all of our wonderful guests. And I hope you all learn a lot, and I'll be back.
All right, everyone. Thank you for joining us. In 2011, Kipling Primus and Jazz 91.9 WCLK launched The Local Take with Kipling Primus. This public affairs show features discussions about critical issues facing Atlanta and profiles of organizations doing important work in the community served by WCLK. As public broadcasters, it is a part of our mission to engage with the community and feature people and issues that aren't always covered by mainstream commercial media outlets. From health to finance to cultural events and politics, The Local Take has become a source for the community. Journalist Kipling Primus is a graduate of Howard University with a BA in journalism and Clark Atlanta University with an MBA in marketing. She has a long career in public and commercial media. She is also a veteran facilitator for StoryCorps Atlanta Studio and has written extensively on global and local initiatives for a number of publications and media outlets. Tonight, Ms. Primus will be your moderator, and so I am turning it over to you.
Thank you, Joy. Thank you so much. And I am happy to be here because we have been struggling with this pandemic for a little bit over a year. I think it has affected us not just physically, but also mentally. And it's kind of hard to be scared that you might catch a disease and die just from breathing. So I am glad that we're here to discuss this, and I'm going to have our panelists introduce themselves. And Dr. Hobson, I'm going to start with you.
All right, good evening, everyone. I am Maurice Hobson. My day job is that I'm an associate professor of Africana Studies and History at Georgia State University. I'm one of the ways in which I've worked in conversations around vaccines and COVID-19 is that, as I stated before, I am the son of a late epidemiologist who studied sickle cell. I grew up in the Alabama Black Belt. And one of the things I used to tell my father is if you come up with the cure for sickle cell, someone has to convince folks to take the cure. And so instead of studying the hard sciences, I study the social sciences to be able to weaponize culture, to be able to communicate with folks. And so I am here to discuss the ways in which the Black community have been impacted by COVID-19 and to talk about ways in which we should, consider trusting the vaccination process. Thank you.
Thank you. Thank you so much. And Dr. Angela Marshall from the Black Women's Health Imperative, if you could tell us about yourself and your work.
Good evening, everyone. Angela Marshall. I'm an internist by training, a physician in private practice in Washington, D.C. And I've become somewhat of a doctor police to all of my friends and family, because every time something goes wrong in the hospital or when people are mistreated, they call me. And it's a shame the number of stories that I've heard. In fact, it's gotten so bad that I feel like I've been traumatized as much as the patients, because I've just heard some horrific stories. And so my work with the Black Women's Health Imperative is to shine a light on disparities, to shine a light on implicit bias, and to end systemic racism in healthcare. And that's why I'm here today.
Thank you so much. And Michelle Norris with National Church Residences, if you could tell us a little bit about yourself and your organization. You're muted. Thank you. Yeah.
I know the old expression, I thought we should learn this by now, right? Thank you so much for having me on, and I'm humbled to be here as part of this group. Our organization is a nonprofit that really focuses on senior housing and healthcare. We have around 20,000 seniors that are in our care in some place, whether it's affordable housing like we have in Atlanta, skilled nursing facilities, assisted living. We care for people in their home with hospice. So this is our world. In Atlanta, we have 8 communities. I've been really privileged as part of our team to be working in the Atlanta market for about 20 years. I've spent a lot of time in the Atlanta airport, and we've built out our own local Atlanta team. So we have 8 communities. We have one that is opening soon and one that will be starting construction. We are just so honored to be part of the community.
Thank you. Thank you so much. And Dr. John Wayne Wilson, our mental health expert.
Hello, everyone. It's a pleasure to be here. I am a graduate of Howard University and University of Miami. Currently, I'm in a private practice, solo practice that I've had for the past 8 years. For the past year, a lot of my practice has just been helping my clients deal with the anxiety and depression and other kind of mood changes that have occurred in response to the fears around COVID, the loss that people have experienced, and just trying to manage all the changes that have occurred with all the social unrest last year, the political unrest last year, and trying to find some sense of stability and foundation. Because one of the things that we struggle with as humans is we like to feel like we're in control. We like to know when things are going to begin and when they're going to end. And as I tell my clients, we are not in control of this. Corona is in control of this. What we have control of is our response to what's going on. And just also helping clients kind of deal with the decision of whether to get vaccinated or not. Because there's a lot of fears around that and a lot of mythical kind of thinking around that. And there's a lot of historical things that people attach. And so some of it's coincidental, and just kind of helping clients work through that without, being shamed, being embarrassed, because the fear is real. But as I tell my clients, sometimes our feelings will misinform us or they will straight out lie to us. And so I try to be a balance and try to provide a perspective so they can make the appropriate choice for themselves and their family. And so that's been a large part of the past year.
Thank you. And thanks for doing that this last year. And last but not least, Dr. Jane Morgan from Piedmont Healthcare.
Hi, good evening, everyone. My name is Dr. Jane Morgan, and I'm pleased to be here today. I did my undergraduate at Spelman College and George Washington University, and then cardiology fellowship at Mount Sinai. I currently lead the COVID task force at Piedmont, but previous positions at Piedmont have included leading their cardiovascular research program and strategy for research across the system. Prior to that, I actually spent several years in the pharmaceutical and device industry at Solvay Pharmaceuticals and Abbott, leading their research and development programs in cardiorenal, and also doing a lot of their medical affairs work for their medical devices and structural heart. So with the onset of this COVID pandemic, we certainly have begun to wear different hats. I've been always a big proponent of minority inclusion and enrollment into clinical trials. This has provided an additional platform to continue to have that conversation. And hopefully we can replace some of the blank slates that you may have with some real data. And because you know what happens when we don't have information, our brains take over with imagination, and we want to replace that with some real information.
And Dr. Morgan, before I let you go, there are three folks on our panel who have had the vaccine experience, and you're one of them. Could you please share your vaccine experience? What was it like with the first shot, and what was it like with the second shot for you?
Sure. The first shot, I had somewhat of a sore arm. I am also a Pilates instructor. And so, I gauge really by how well I can continue to teach my classes. And I had really no disability whatsoever. I had somewhat of a sore arm, but I was still planking. I was still side planking. I was still doing down dogs, no problem. The second shot, really different. I had really intense sore arm, very, very sore. To the point that I actually took some Motrin forward, and it really did force me to modify some of the movements that I was teaching in Pilates because I was not able to support myself on that arm. I also had the myalgias that manifested as lower back pains, mostly at night. And then when I took Motrin, I realized that I had a fever because 20 or 30 minutes later, I sort of broke out into a sweat and realized my fever had just broken. I also had headaches for 2 mornings in a row, which really resolved pretty easily with aspirin. So I had about 3 or 4 days of symptoms after that second shot.
That is good to know. And Ms. Norris, you've had the 2 shots as well. Can you share your experience?
Yeah, my first shot was just the same thing, just a sore arm, very much like a flu shot. I get a flu shot every year, and it was really just very comparable. Second shot is now 5 hours in my arm. And so, so far, so good. Again, it's about this same soreness in my arm. And so far, knock on wood, I haven't had any additional reactions.
And Dr. Marshall, you've had your rounds of shots as well. Could you share your experience?
Yes, so the first shot was no problem at all. I had a little bit of arm soreness, but I actually felt great the next day. I was surprised at how great I felt. The second shot, not so much. The second shot, about 12 hours into it, I got really severe neck stiffness and pain. And then the next morning, I felt every joint in my body was aching and a little arm soreness. I just really felt like I had the flu. And I was actually trying not to take anything because I know the CDC had said that they recommend not taking Motrin before the vaccine because Motrin can sometimes blunt the antibody response. And so I was trying not to take it at all. So I suffered through a whole second day. I mean, I was pretty incapacitated in the bed most of the day until my colleague said, you better go ahead and take that Motrin. And that's what I did. And miraculously, as soon as I took Motrin, it was like a miracle drug. I felt immediately better. So
good to know.
That is good to know. And we don't have to, if you're listening, you don't have to wait to the second day. You can maybe take it that first day that you're in discomfort. We've all mentioned the hesitancy of getting the vaccine for our community. And I recently heard on the news, they were saying that where our number is really high is in the wait and see category. So it's people who want to get it, people who don't want to get it, and then the people who want to wait and see. And for African Americans, the wait and see number is exceptionally high. And, people, the news for the last, 6 or 7 months has been talking about our history with the medical system. And they always seem to go back to, the Tuskegee experiment. But the Tuskegee experiment is just one of so many, Henrietta Lacks. Let's not even go that far. Serena Williams, 2 years ago, having a baby and couldn't get the doctors to help her. She's like, I know what's going on. It's happened before. This is what you need to do. And they're like, you're groggy. You don't know what you're talking about. And of course, she knew exactly what she was talking about. And she was finally able to convince them. Just recently in Indiana, a doctor died of COVID and could not get painkillers. The staff at at the hospital where she was said that she was intimidating. But this is literally a patient with COVID-19 who can't breathe that's in a hospital gown. How can you be intimidating in a hospital gown? But Dr. Hobson, can you give us some perspective on, the history? I think Dr. W.E.B. Du Bois came out with the health and physique of the African American in 1906, was it? I think it was. And that was kind of the first time the medical community, from a academic kind of point of view, got to understand what our community was like.
Well, absolutely with that. And thank you for the question. W.E.B. Du Bois moves to Atlanta in 1896, between 1896 and 1910, to create a clinic to study Black life. And of course, medicine is a part of that. And, as you stated before, I mean, oftentimes we go to the Tuskegee experiment. We look at Henrietta Lacks. But also a good friend of mine, Dr. Deirdre Cooper Owens, wrote a great book called Medical Bondage that looked at experimentation on Black women in terms of gynecology. You have all of these different things. And here in the state of Georgia, you have Black women who are dying on the delivery table at the rate of those in underdeveloped nations. But I want to give you all a flip on this. This conversation around vaccination, particularly Black people receiving vaccines, or the fact that they don't want to receive vaccines, is actually anti-Black. Now, I want to tell you what I mean by saying this. Each fall, I teach a course titled The History of African Americans in Georgia. We spend the first 6 weeks of the course in the Georgia, South Carolina Low Country, the Geechee Gullah, amongst the Geechee Gullah. And one of the things about that particular area of the state is that it remained overwhelmingly African. It remained, the language was African. They cultivated rice, so they weren't bringing slaves to this area. They were bringing scientists. They were bringing doctors. They were bringing all kinds of folk. And one of the reasons that preservation was able to take place in the Sea Islands was because the Africans that were brought there were also doctors, and they could inoculate. They inoculated against malaria, yellow fever, and all kinds of different things. And that's part of the reason that they could preserve the culture, because it limited the white presence in this particular area, where this particular group was able to maintain their Africanness in a very long-standing way. And so as we talk about this conversation, sure, there are reasons to be skeptical of the system. However, considering what the alternative is and understanding how Black communities have been exacerbated, particularly because of issues around racism, discrimination, sexism, ageism, and whatnot, access to healthcare, food deserts. I think it's important for us to consider vaccination, because Black communities have been severely damaged by COVID-19, and we need to look at a solution as to how we can move things back as close to normal as possible.
And it seems that right now, vaccination is really the only way for us to get there. So how do we change this? How do we flip this? I got my first shot at Mercedes-Benz, Fulton County Board of Health. I'm caregiver to my 81-year-old dad. Everyone in there was white. There were like 3 Black people and a Mexican family, and everyone else was older white people. And I don't think there's anything wrong with that, but I would have thought that Mercedes-Benz was there in our community on the MARTA line, walking distance from, Vine City, that we would be there, and we weren't. So what do we need to do to get those folks out of the wait and see line? And I don't know, Dr. Marshall, would you like to take a stab at that?
Yeah, I think what we're seeing is a lot of mistrust, and with mistrust comes disenfranchisement. We have disenfranchised from the healthcare system in many cases because of the mistrust, and we have to be careful about that. But, and maybe Dr. Wilson can comment on this, but when people have been traumatized, when people have experienced systemic racism in society, it's hard to trust those systems and then go and get care from them. When it comes to the police and the justice system, we can disengage from those and hopefully not need police and hopefully not need anyone from the justice system, but we actually need healthcare. And so we need to be able to engage with healthcare, even though this is a system that we don't trust. And so I think it's important for us as African Americans to really do our due diligence in finding those healthcare providers in whom we can trust, because I can promise you there are many healthcare providers, both Black, white, Latinx, and otherwise, who really do care about us. And so we have to do that extra work to find the people that are going to care for us the way that we need to be cared for, and the ones that are going to be worthy of our trust. I think we also have to be careful of misinformation, because when you've had bad experiences with institutions, you're more likely to believe negative information because you've had a negative experience with it. And so one thing that I've experienced, from my friends and family and patients is they always come bringing all kind of, crazy conspiracy theories. Have you heard about this? Did you know that? Is this true? Is that true? And so they come to me to fact check. But one of the things I come back with all the time is consider the source. Where did you hear this from? If it was YouTube, it's probably not legit, And so I think as Black folk, we have to start fact checking our information. There are people who want us to be in the dark. There was an article published in the American Journal of Public Health about Russian influence and how Russians have launched misinformation campaigns about vaccinations in our communities. And so there's all sorts of sources of misinformation out there, and we just have to be really careful of where we get our information from.
Thank you. Thank you for that. And Dr. Morgan, one of the things that you have constantly talked about is those clinical trials. Can you tell us why it's important for us to get into those trials? How can we learn about the trials? I've been seeing a couple of vaccine trials for COVID, on Facebook, but do you really want to sign up for a vaccine trial on Facebook? I'm not sure. But how can we become a part of that part of the healthcare industry?
So when we look at clinical trials, one of the things that I try to talk about when I go out and speak with different groups and organizations is for us to begin to think about clinical trials as a bridge to healthcare, as a way to begin to narrow the divide in health equity. If we can get access to these clinical trials, this is where we have the most touch points with the health system. You have the direct phone number and contact information of your nurse coordinator or your research coordinator. Your physician is involved as a principal investigator. There's a regional physician who's overseeing that doctor. There's a national physician overseeing the regional physician is overseeing the local physician. You have a team of people who are watching you, observing you, invested in your outcomes. You have direct contact information for people that you can reach 24 hours per day. If you are uninsured or underinsured, the healthcare companies, these pharmaceutical and device companies, pay for these drugs and medications because they want to make certain that they can have data that they can present to the FDA. Where else do you get healthcare like that? And yet we continue to speak about we don't want to be guinea pigs, but the people who enroll in these trials by and large are white males. And when this data is presented to the FDA, this is data based on this particular demographic. And so when these drugs and devices are approved, it's unclear whether they have any relevance to our population. And as a cardiologist, and we're prescribing these drugs in the office, the first time your patients see the drugs is when they're out in what we call the real world. They're outside of these controlled clinical trials. And then we begin to hear while you're at Disney World and while you're on a cruise or while you're at a PTA meeting, different side effects and interactions that you are having in an uncontrolled environment. So I ask you, on which side of the spectrum are we really the guinea pigs? If we don't participate in these clinical trials, then we don't have any information on these drugs when the FDA is approving them. Isn't it better to have these side effects when you're in the midst of a cluster, a cloister that is surrounding you and protecting you, and you have direct access to report these side effects to someone 24 hours per day, as opposed to not being in the clinical trials because you're concerned about research, and then we're unclear on whether the drugs have any impact on us. And so this is the type of thinking that I want us to begin to understand when we look at Donald Trump. When he contracted COVID and he was sitting in the White House, doctors understood very clearly he's 74 years old. He's overweight. He was desaturating, meaning his blood oxygen levels were dropping. That's an ominous sign. That's a concerning sign for doctors. They helicoptered him over to Walter Reed. What was the first thing that he received? Something that most people had never heard of. He received Regeneron's monoclonal antibody therapy. People were asking, what is that? You know why you're asking what that is? Because it's not available. It's not FDA approved. You can only access that through clinical trials. He received emergency use authorization to access something that's not available to the public. The only other people who had access to that drug that was credited with not only, if not saving his life, preventing the downward trajectory that he was on. The only other people who received that were the people who were enrolled in those clinical trials. So why are we circumventing platinum level health care? That's platinum level health care that the whole world saw. And I will just end with this. If you are seeing your physician and you have a chronic medical condition, heart disease, cancer, diabetes, and you're not being offered a clinical trial, you're being treated optimally, meaning you're being treated to the absolute peak of evidence-based medicine, FDA-approved drugs, but you are not being treated maximally. Maximally is access to therapies and drugs that are coming through clinical trials that are going to have relevance to our population, access to tomorrow's therapies today. And when you look at Donald Trump, that was an example for the entire world to see of what platinum level health like. And that's to understand with regard to our health and also with regard to narrowing the gap in health equity. And here really mean.
Thank you. Thank you so much for giving us the detail on what those clinical trials mean. And should we just ask our primary care physician, if you've got one of those chronic conditions, should you just ask, can I get into a clinical trial? Dr. Jane, can she hear me?
And so if that question, yes, so if that question is to me, can you hear me?
Yes.
And so I think, you know, one of the issues that we have is that where is the access? And so the next layer to that is our physicians, the African-American physicians by and large are not connected with major medical centers, are not connected with these pharmaceutical companies. So physicians are the ones who serve as principal investigators. The number one reason that a patient will enroll into a clinical trial is if they are approached by a trusted physician. So the white physicians approach their patients. We don't approach our patients because we are not serving in the role of principal investigator. So we also need to raise our hand and begin to be involved in research. The pharmaceutical and device companies need to begin to recruit Black physicians because 80% of our population is seen by Black physicians. And so if we're going to be involved, these are our trusted providers. These are the ones that have one foot into the medical community, one foot into the cultural community, and can help to bridge that divide. And so it does become somewhat complex, but you can certainly advocate for yourself, search your local medical facilities for trials that might be relevant to whatever your condition is. But hopefully we will continue to move in this direction where more and more people begin to raise their hand and say, include me, opt me in. I am raising my hand to say yes. I want to make certain that I am a part of this solution because this is going to impact my health. And we need to begin to look at this beyond Tuskegee. Not that Tuskegee didn't happen. It certainly, absolutely happened. All of it happened. I mean, that's another lecture that I give. But I also want us to begin to look at it in terms of 2021 and now why we are excluding ourselves based on historical context and how we need to begin to rethink this such that we can advocate for ourselves and our health.
Thank you. Thank you so much for that. So we've all talked about how the African-American community, the Black community, has been decimated by COVID. But the other community was those over 65. So Ms. Norris, can you talk about, you know, what it has been like, you know, for some seniors who may have been getting, you know, help that was going to come in, you know, 2 or 3 times a week, and then all of a sudden that's all gone.
Right. Yeah, it's been very hard. The isolation for our seniors has really been hard. Now, we are really, as an organization, we have property managers and service coordinators, and our maintenance staff have really almost taken them in as family in this time where their families are not allowed into the communities. So, but that being said, we still have clearly a risk, and we know it's a health risk. And Dr. Wilson, I'm sure you know this way better than I, the impact of isolation on your mental health. And so we know how hard this balance is, and it's been very hard for our staff, but they've done an amazing job being able to really connect, do fun things in ways to connect our residents and help them to feel like, and continue to engage them. I worry a lot about our residents, our citizens who are seniors in their homes that are afraid to come out, that are isolated in their homes without a property manager and a service coordinator trying to reach out and making sure they're engaged. So it's really been a hard struggle. I think I'm very proud of our staff, but there's no question that the faster we can get the vaccine in enough arms, the faster we will be able to open up our communities and allow our seniors to feel safe engaging again.
Thank you. Thank you. And Dr. John, I am not a depressed person. I don't suffer from depression, but I'll tell you when it hit me. You know, when we first locked down and there was talking that we were going to be opening up middle of June 13th, I think the mayor of Chicago said. She's a sister. I was like, I'm going with her. June 13th, I'm good. Then in July of 2020, Google sent out notice to their employees that they would be working from home until July 2021. And it took me about 2 weeks to realize I was in a depression. I was depressed. I was sluggish, not motivated, didn't want to work, you know, sleeping too much. And I finally realized, oh, you got to, you know, something's going on. You need to shake this off. But that was just a person who has never been clinically depressed, doesn't have anxiety, and, you know, just a regular average Joe. I cannot imagine how people with challenges are dealing with this, let alone the rest of us. I mean, you mentioned the trauma that we've been living under, not just with the pandemic, but with the racial unrest and the political unrest. And they tried to overthrow the government, and we were supposed to get up the next day and walk to our dens and keep working, you know, and we have for over a month. What is going to be the result of this trauma that we have been living in? You know, what happens to you when you're living under this kind of trauma?
Well, Kipling, you know, you touched on something I don't think many people talk about or realize. When you got that information about Google, that made you had to reconcile with the reality of the seriousness of the virus. And so my experience with my clients is, if they are not willing to reconcile that reality, and to be honest, I think a part of human nature is to not reconcile certain risk, because once you do that, that means you have to do something, right? And so to me, that explains why people will have become like somewhat casual, some people at least, in terms of responding to the coronavirus. Because if you take it seriously, then that means you have to do certain things. You got to make certain choices. And so if you haven't done that, you're not like, I mean, like we're all talking about, you know, the access to different services and this and that. That stuff, it goes in one ear and out the other if the person hasn't accepted that this is this is a real thing. But once you do that, then it's like you have to accept that I'm at risk. And a lot of people aren't either emotionally ready to do that. And so they just act as if it's not as serious. Because I remember when it first, you know, let's say back in, I think, April, when I moved out of my office and started doing virtual therapy from home, and ended up talking to clients, and they had relatives who were here who weren't taking it seriously, because at that point, New York City, New York, Connecticut, New York were the hot spot. And their response to not taking it seriously, like, well, that's up there. That's not down here. So I'm good. And so I think that's still, that kind of thinking is still in play. It's like, because once you recognize, you got to be thinking, okay, do I need to get a will? You know, do I need to take better care of my senior parents? Do I need to pull back? And so if no one wants to be locked in the house. No one likes to not be able to go to their favorite restaurant, or go to bowling, or go to the movies, or go, you know, and so instead of dealing with the reality of it all, they get stuck in that kind of, well, I'm not going to reconcile with that. I'm just, you know, it's either fake news or they over exaggerate. Now, I don't know how you over exaggerate almost 500,000 people dying in less than a year. But as humans, we do that because I think some people start feeling overwhelmed. And so if you add on to that some of the things that's already been talked about, it's like being forced to stay in the house, isolation, and you're just and fear, not feeling like you're in control, because we like to feel like we're in control. You know, that just adds all to the psychological burden that you're carrying around, and then life becomes less enjoyable. People are upset. They may be stuck with people they don't want to be stuck with. Like one of the things I noticed is if someone was more extroverted than not, they struggled a lot because they needed the social contact. And in conversation with people who tended to be introverted, they recognized at some point, well, this is pretty much how I live my life anyway. And so they tended to manage it better, at least in the beginning. But now I'm noticing even introverted people are like getting edgy and amped up, but not being able to go out, can't go see, you know, their grandparents or their nephew or niece. They can't, like the travel thing in Atlanta's full of foodies. They can't go to the restaurants, you know, but I still see friends out, you know, at restaurants, no masks. They claim in social distancing, and I'm like, you know, and then I have clients who are getting upset with those people who are hanging out because they feel like, okay, how are they hanging out? I can't go out. What the hell are they doing out? You know, and so all that's going on, and I don't think all that stuff is being talked about. So I think stats are coming at people, information's coming at people, but until like some of the emotional stuff and normalizing people's reactions and not having people feel guilty and ashamed, you know, or resistant. I mean, because I think I'm the only one who hasn't had a shot yet. Now I want to have a shot, but I know initially I was like, you know what, I'm gonna wait and see. But not because of like Tuskegee thing, but it was a novel virus, new vaccine. I tend to think of myself as a scientist. Let me see some of the numbers. Let me see something. Let me get some. So once I got, then okay, cool. And so I haven't been able to get coherent information on where to even get a vaccine. So, and I'm savvy with internet. So that's also in play, you know? And so
one of the questions that has come up in the chat is how to get a vaccine. But before we go there, Dr. Morgan has mentioned health equity. A lot of people might not even know what health equity means, but I'm hoping that out of the pandemic, will more attention be paid to health equity? How can we move our nation forward so that, you know, your health isn't based on your zip code, so that everyone has a chance to grow up and live a healthy life? And I don't know who wants to take that. Dr. Marshall, you want to?
Yeah, health equity means everyone having equal outcomes. And so as it stands now, you know, as Black folk, we typically die about 10 years earlier than white people. And so although that health gap has closed over the past century, there's still some closing that needs to happen. We've had some major improvements in some areas. This COVID-19 pandemic has widened that gap because we, as African Americans, have been disproportionately affected. We've had a disproportionate number of deaths. And then ironically, we've got this mistrust that is making us disproportionately unwilling to get vaccinated. And so I think we really have to deal with ourselves and also, again, fact find, look for information that's going to make you feel more comfortable with taking the vaccine, because when your number is called, you want to make sure you don't miss out on that opportunity. I wanted to share a quick story. A long time ago, back in 2009, when we had the H1N1 flu outbreak, right? That was the first time in my career where they had to actually issue a second flu shot because the first one didn't cover that strain well enough. And so I happened to be in DC, and at the time, all the clinics were out of this add-on flu shot. You could get it nowhere because everybody had already taken up all the doses. I happened to be driving through a brown part of town, Southeast DC. Now, this was pre-gentrification. And I saw all these white folks standing outside in Southeast DC, which looked very out of place at the time. And so I happened to look up at the sign, and they were standing outside the health department there because that was the only health department in town that still had H1N1 flu shots. And so I share this story because as Black folks, we have to make sure that we're not shooting ourselves in the foot and make sure that we're not missing out on important health opportunities, just as Dr. Morgan pointed out, even with regard to research. And especially with regard to vaccinations, we need to make sure we're not missing out and we're not hurting ourselves.
Right.
And Dr. Hobson, do you think we can take the pandemic and make the change that we need systemically? Because when I think about we first started talking about this, the news from China was that people who are hypertensive, diabetic, and obese are having the worst outcomes. And I got chills because I knew that was us. And, the epidemic of diabetes is rampant in our community. The epidemic of high blood pressure is rampant in our community. And believe it or not, I was so sure that with the lockdown, cases of HIV would drop. They increased. Can we use this moment socially to bring about real change so that we can have health equity?
I absolutely think that we can. But I think that there has to be a multi-headed approach to it. And one of those is that I'll give you an example. This past summer, Atlanta erupted with rebellion after, the murder of Breonna Taylor and Ahmaud Arbery, George Floyd, Rayshard Brooks. And folks were marching in the street. Well, all these corporations began to do things like, hey, we're going to play Lift Every Voice and Sing before the NFL football game. Who wants that? I need you to cut the check. I need corporations to put $10 billion over a 10-year period in coffers in partnership with historically Black colleges to produce medical doctors, scientists, to produce nutritionists, to be able to put your money where your mouth is. And what happens with that is the community that those Black and brown scientists and physicians and healthcare workers come from, they're able to go back to their communities and tell Big Mama and Big Daddy and their people, hey, come, let's do this. So I think that we have to really take a stance, and we have to force these corporations to not do all of this lip service, but to really put their resources to open equity and inclusion in particular kinds of ways. We have to figure out ways in which we can implement an affirmative action program to where supermarkets and gardens and all kinds of vegetable plate, whatever it is, that they can be in these particular areas that have. So we have to change some policies. in terms of doing that.
I think a lot of people are saying I'm ready to go back to normal, but I think we got to change what we thought, was normal. So this question, Dr. John and Dr. Morgan, I, would like for you guys to consider, is it a cultural fight to get us to try to trust and embrace, the health system? Because even when we go to African-American doctors, I mean, I had a friend who swore he was managing his high blood pressure with his diet, that he could tell when, it was, and I was like, it's called the silent killer. I'm begging this young man, please start taking your high blood pressure medicine again. Lost a girlfriend to stroke. One of her friends, months later is in the hospital with blood pressure going crazy, but she stopped taking it because she felt better. Also, as I mentioned, diabetes is endemic in our community. I mean, my dad is 81. He didn't start dealing with diabetes until 81. But there are people in our community, 32, 28, 40, who are taking insulin, really and truthfully out of control type 2 diabetes. Is it our culture? Is it the system? Is it a little bit of both? And what do we need to bring to bear to change this?
So when you look at the healthcare bias in our system, if we look at the opioid epidemic that has been rampant in our country for the last few years, it's not by happenstance that this epidemic has only, for the most part, impacted white Americans. That's not random. Reason for that is that prescriptions for opioids are given more generously to white patients than to Black patients. Black patients are not seen as having pain that is equal. They're not seen as needing pain relief. They're seen as drug seekers, or just minimized and ignored and dismissed. And the data shows that opioid prescriptions, if you don't believe me, are written at 33 times the rate for white people than there are for Black people. Do Black people have 33 times less pain? And when we talk about pain, it's not just physical pain that goes untreated. If your physical pain goes untreated, it impacts your healing. It also develops emotional and psychological pain. And where does that go over time? Additionally, when I went to what Kipling is talking about with regard to obesity and diabetes and Blacks and trials, if you look at the FDA briefing documents that were submitted by Moderna and Pfizer and read them as I have and have reviewed the data, obese patients, specifically in the Pfizer trial, were included at 70%, either obese or overweight, the criteria that they use. That's a huge amount. They enrolled 40,000 people, 70% of whom met the criteria of being either overweight or obese. So I think we can be confident that the data is relevant to the obese population. If I look at the population of Blacks in that trial, Pfizer enrolled 9.8% Blacks. Moderna enrolled 10.3% Black population. Blacks in general participate in clinical trials often at less than 5 or 6%. So actually, these companies were intentional and they worked to have these percentages. And even though we represent 13.4% of the population, they were not perfect, but they actually were pretty good. It's one of the better enrollments I've ever seen that was not specifically targeted to African Americans. When I look at that data, and I spent a weekend reviewing it and I have reviewed it again and again, and look at subpopulations, the only population that experienced zero incidences, none, of COVID disease following the second vaccine were the Black population in both trials. And so when we talk about 94.5% efficacy for Moderna, 95% efficacy for Pfizer, that's the efficacy of those trials Black people in those trials, 100% efficacy in both trials. And so I think we need to think about that when we think about data. We need to understand the importance of involvement in clinical trials. We need to understand that there are 135 other companies developing COVID vaccines. Moderna and Pfizer have been first to market. When all is said and done, they may not be best in class. And the only way that we will know that is if we are involved in trials. What I suspect will happen is that we will have multiple vaccines on multiple platforms. One company will have a vaccine that perhaps is better for children. One will be better for the elderly. One might be better for patients with heart failure or cancer. If we're not involved in these trials, we don't know that. So just remember, these two are first to market, an enviable position in the pharmaceutical world. You have no competition, but 135 are working. They may not be best in class. And when this is resolved, we want to make certain that our data is there and that we can select the vaccines that impact us most positively.
And Dr. John, how do we overcome this culture in our community? And it's really a human thing of not wanting to get help when you know you need it.
I mean, and that's a complex thing to pull apart, because when you said that, I started thinking about some things. So when we take culture, right, like one of the things I noticed, there's a difference between the culture of men versus the culture of women, right? And so, and then if you put on the culture between black seeking help and then white seeking, that's another. And if you put like black men, I mean, there have been times I've had to get into not a verbal tussle, but I had to like press black men to go to the doctor, get a physical. And I remember one client in particular, his wife was trying to get him to go to the, because his leg was messed up and it had been messed up for weeks. And I just asked him, said, so what will it take for you to go to the hospital? Will it take your leg falling off? And he said, yes, like it has to be that serious, and then it's just a culture of American culture does not really, it shames people for seeking out help. Like it's kind of not okay to do that. Now we can talk intellectually about the benefits and why you should, but emotionally, you're not supposed to really ask for help. It's individualism. Pull yourself up, work it out, fix it, handle it. You're not, and so I think that gets played out in terms of like whether or not to seek medical assistance or not, because it gets attached to being weak. Like, I don't want to take a pill. I don't want the pill to control. Like, that's not a narcotic. It's you take one little pill and your blood pressure goes down and you won't stroke. I mean, I have to break it down like that. But people see the pill as having control over them. And it's about, it's the willpower thing. I don't want to be controlled. And so that's a harder thing to address, because that's tied to family culture. That's tied to neighborhood and community culture. That can also be tied to church and religious and spiritual belief. So you talk about pulling all that apart. That so it's not like I mean, we like tips and we like specific strategies, but this is such a multidimensional problem, And so are we even having these kind of conversations with people? Typically not. And so when it comes up with I know with my clients or colleagues' clients, I'm usually the first person that they've ever had these kind of conversations with. And this could be a 50-year-old man, or hearing stories about, and this also, this kind of shocked me, but hearing stories about either the girlfriends or wives tricking their boyfriends and husbands about doctor's appointment. Hey, honey, can you take me to the bakery? And they show up at the doctor. I'm like, what? Like, what is that? You know what I mean? And so I think that makes it much more difficult. So to pull it apart is hard. So I think it's simpler to kind of, to focus on what can we all do individually to assist our family in creating a culture where it makes sense to go, to get vaccinated, check on your health, not feel ashamed if you are hypertensive, diabetic, or have a pain. But a client just told me the other day, a friend of hers died because he didn't get a bump checked out on his back. And from that moment, he recognized the bump. He kept telling everybody, I'm going to go. He never went. Whatever. it ended up being cancerous and he ended up dying. And so he was a young man. But that is, I mean, so how do you attack that? Patience and being forceful. Not like I don't let my clients off the hook. So when you come in with some crazy stuff like that, I'm going to challenge you. Then I'm going to press you to do what you need to do. But I don't know if we do that as a community, you know, and I don't care what size community we're talking about. Like I said, whether it's family, whether it's your neighborhood, whether it's your church, whether it's the city, state, we don't do that. You know, and so, and I think that just feeds into people's ability to kind of deny and rationalize away making certain movements. So I'm not going to hospital because when people go to hospital, they die. I don't want to die, so I'm not going to go. I mean, I've heard that, said from people, which is not untrue, but like if you don't go when you got to go, you probably
are going to die.
Yes, right. But you got to accept that reality, and some people that's a struggle.
And Ms. Norris, with seniors, it's the same thing. They've gotten older. They can't do the same thing. I took a driving class with AARP, and I was told that after a certain age, you think you're whipping your car because when you were 30, it whipped.
Yeah.
But when you're 50, it doesn't whip the same way. You're not. Right. It's not the same. So what has that been like for you with your seniors?
Yeah. So I think that there's two things. I've seen a couple of things through the chat that are really important to focus on here. First of all, in our communities, we were able to partner with the pharmaceutical as part of that long-term care contract. So we were able to get clinics brought to every single one of our communities. So we have those 8 communities between 50 and 300 seniors in one spot. And we brought the clinic to them. And so again, the service coordinator, the managers helped educate them. And one of the things, so I'll say 2 things. Number one is we have to make education in English. We are handing out Pfizer hand FAQs and telling people to read it. And and say, now you should be convinced to go get the vaccine. It's we need to market it like you market anything else. If we want to get people to be comfortable, we have to tell them about it over and over and over again in language that they feel comfortable with, which is English, not medical language. And then the second thing is, and I saw somebody talk about this in the chat, access. So again, don't think about my seniors in my community where we're bringing it to them, but what about the seniors in the community at large? What do we tell them? Go to the internet and log in and find something. That's a great idea. Number one, they may not have broadband. Talk about equity. They don't have broadband necessarily in their home. They may not have real comfort with the internet. And so we have a whole big problem with the fact that our channel of which we sign people up is a channel that is not helpful for our seniors. So we have to have a couple things. One is navigators. People that will help, whether it's your child or a volunteer or your primary physician that will help you get signed up so that you're not trying to do that. And then I saw that at least in Fulton County, they're trying to create a single door access system so that people aren't having to go to 5 different places and try to get on 5 different lists if they can figure out where those 5 lists are. So we've got to make the access easy and simple to register, and we have to make the education a lot simpler and many times.
I saw the question about access to the vaccine. I'm not sure if anyone else has a question that they would like to put in. There's a question about deaths associated with the vaccine. Dr. Morgan, can you address that?
Yeah, I think that's a great question because it highlights the amount of misinformation that's out there. And when we talk about deaths, deaths can occur whether someone has taken a medication or hasn't taken a medication. And I think these things get highlighted in misproportion. So when we look at misinformation, what we really want to look at is make sure that you get a credible source and look at the real data And don't forget, Pfizer enrolled 40,000 people. Moderna enrolled 30,000 people. We're talking about information on 70,000 people. And so all deaths that occur within these controlled trials are adjudicated, meaning they are looked at with regard to whether they occur in the placebo group, meaning there are people who take a dose of vaccine that's really just sugar, so maybe just a sugar, and then a group that has the real vaccine, and they compare them. So I think we need to be concerned really about misinformation that goes out. And so those would really be my thoughts on that. These vaccines, according to the data that I have personally reviewed that was submitted to the FDA, have a really good safety profile. And the first thing we do when we're developing drugs, our phase 1 is safety. We don't look at efficacy, meaning how well the drug or vaccine works. We first look at safety, because if a drug or a vaccine is not safe, then there's no reason to develop it, no matter how well it works. So be intentional with where you are receiving your vaccine, your information, and make certain it's from reputable sources, including don't hesitate to call your physician's office and put those questions there in front of your physician. Get the information from a reputable source. But that's actually a great question.
Right. And I like to add something, piggyback on that. It's like the decision to, if you're focusing on the risk, whether you get vaccinated or not, it doesn't take off the playing board death. I mean, that's always in play. And so, I always like to identify what things are always in play, take it off your decision-making list, and address what you have to address. Because if you get the vaccination and, you have some side effect or whatever, or something, that's sad, but if you don't get the vaccination, you also at risk. The risk does not go away. And so we many people think they are kind of controlling this risk or unknown, but no, you're not. It's not eliminating anything. And so it's much less risk in getting vaccinated than to not. Because we know what can happen when you're not vaccinated. Like that's at this point at 470,000 people dead in a year, we kind of know what in a concrete way. And so, but people get caught up in it, like somehow they can manage or negotiate the risk away. And that's just, now you're just playing mental gymnastics, and so.
Our next question, and I'm not sure if you all have an answer for this, but do we know when the vaccine will be available to the general public? Does anyone?
Well, I will say this. I just had something pop up on my phone that said that the president had secured another 200 million doses, and that, if all goes well, that the United States should be vaccinated by July.
Okay.
I don't know what that means.
Mm-hmm.
I'm pretty sure that logistically, the federal government is going to have to partner with other corporations that are used to rollouts and the logistics of moving product from one place to another. But that just broke within the last 10 minutes.
And I think that goes right back to, if we're going to have that kind of volume, we have to get a system, and the systems are being driven locally. So we'll be able to get all the vaccine we want. I mean, that sounds like it's really encouraging about the supply, but the supply chain can break down horribly at the local level. And so it really does go back to, we've got to think about how to make this easier and more efficient.
We've got another question. Do the doctors recommend one vaccine over the other? Would you prefer Moderna or Pfizer? And can you all say which vaccine you had?
I had Pfizer.
I had Moderna. I've done a little podcast on this, so I'll just say the end of the podcast. I don't recommend one over the other. They're fairly equitable. They're both messenger RNA vaccines. They both have similar safety profiles. They both enrolled approximately the same percentage of Blacks. into the trial. One enrolled 28% Latinx, the other enrolled 20%. Their emulsion, meaning what the messenger RNA is mixed in that you receive the injection, is pretty much the same. It's lipids, meaning fats, salt, sodium phosphate, potassium phosphate, sodium chloride, potassium chloride, and sucrose, which is a sugar. And then Moderna also has trimethamine, which is a type of substance to balance the pH. Moderna will take longer to reach that 95% efficacy because the doses are taken 28 days apart, and then you don't reach the 95% efficacy for 2 weeks after that second dose, so it takes a full 6 weeks, whereas Pfizer's doses are taken 3 weeks apart, and then there's an additional 1 week after the second dose to reach full efficacy. However, I think all of those points are moot because we really don't have enough supply to choose which vaccine you're going to take. So
Right.
I think you take what's available to you. I had Moderna, so I will wait it out for 6 weeks. I think you don't wait for one over the other.
Right.
The only other thing that I will add is if you have a specific allergy to something called protamine sulfate, which you can find in laxatives or stool softeners or colace, that's probably the only single contraindication maybe to these medicines that you have an allergy. You would know that because you will have had a stool softener like Miralax or Go Lightly or something. And that's the type of lipid that's in both of them. Other than that, any other allergies are not contraindicated because remember, this is not a live virus. This is not a live virus. So these allergies of chickens and eggs and all of that, it does not apply here. So please, consider this virus, consider this vaccine, step up, opt in. I think, we've made great points about, sort of trying to figure out, what are the pros and cons when we measure where we are within this pandemic. So I received Moderna. I didn't have a choice. I didn't really care.
And Dr. Marshall?
Yeah, I also received Moderna, and I agree with Dr. Morgan 100%. They're both very similar. They had very similar results in the clinical trials, and they have a very similar mechanism of action. So there really isn't a big difference between the two. And so I agree with taking whichever one comes your way first.
Mm-hmm.
We have another question. How do you talk to siblings about getting older parents a vaccine if they are not in support of it? Which you got to get your parents a vaccine, people. You got to. If you want them to live, you got to get them a vaccine. What do you say to siblings?
So I think one of the things when I have these conversations, we certainly go over a lot of the historical context. And we go over, what their relationships are with the healthcare system, their providers, and I think, their physicians. That's a great place to start. Ultimately, the goal of my conversation is not to have people get the vaccine at the end. The goal of my conversations at the end is for us to determine when we will start to think about when we might start thinking about it. So that's how far removed we are. So I just want to know, when are we going to think about when we might start thinking about it? And we sort of start to peel the layers from there because these, still waters run deep. Mm-hmm. And so, we can't get everything done in one conversation, but if you can leave with a nugget where people will say, okay, all right, I'm not going to think about it today, but maybe Friday, I might start to think about it. And then, and then have the door open for people to come back for more questions, because oftentimes after you leave, when you're talking, people can't think of anything. You know how that is. You go to the doctor and everything's fine. My leg was hurting, but now it feels great. 2 weeks later, people thought of, they've been on social media, they've heard all kinds of things. They have 20 questions. Now they want to come back. And I always think that that's always a good indication, because that means people are starting to be a little bit more engaged if they contact me and, I have some questions for you now. So I think the goal is not to have people immediately take the vaccine. The goal is to have people to begin to have the conversation.
Right. I agree. It's a process of cracking that door. And then if I can help you, because information is power. Now, you know, if because people can't find stuff, so let me go on the internet and find some stuff. I will find some information. I'll even package it for you, and I will email it to you because I want you to be informed. So yeah, I mean, you can't bluntly hit people in the head, get them to do stuff. But if they open that door a little bit, to me, that's like go. And so then I think about what can I do to assist? And then people get intimidated by websites, the internet, or even just Googling things. I said, well, let me look, let me see if I can find some stuff. And if I can find some stuff, I package it together and then I email, because that does begin the conversation. Right. And it opens up them to ask me, ask me questions, professional questions, or even personal. Like they want to go, okay, forget you're a doctor. Like, what would John do? That kind of thing, you know. But it's then I'll slowly just kind of wedge the door open and entertain, you know, their questions and their curiosity, and I'll tease it and I'll throw some stuff out there just to get them hooked, you know. And eventually, reasonable people will start to come around and see it, you know, and make some healthy choices. But yeah, whatever you gotta do to crack the door.
And Dr. Hobson, we have another question that says, how do we get past the historical misinformation and mistreatment?
Well, as been so eloquently stated on this panel, you know, several times, is we have to reconsider where we are and what we're doing. And the thing about culture is one must acknowledge one's culture. One must acknowledge the fears, but then you have to talk them through the process to help them understand, is this truly a fear? I've had the distinguished pleasure of sitting with statesmen from around the world, American presidents, not the most recent president, but American presidents. And one of the questions that I'll often ask them is, I'll say, how do you deal with stress? And what many of them have said to me is, you know, a lot of times fear, what we fear will happen, most times it doesn't happen. Right. And so the thing about this is to truly do the kind of research that's necessary, weaponize history and culture, go and talk to particular community entities such as, you know, churches, masjids, community centers, of course, through the medium of virtual. I mean, we're still trying to social distance, but to present it in a way to where we have to convince the public that this is the safest alternative that we have at this point. And that is based on data. And then it goes back to pipelining our young people, our young people of color, to go into the sciences, to go into healthcare in particular ways, so that they can be at the drawing board of when, you know, of clinicals, of tests, of all kinds of different things. They can invent, they can use their genius to be more inclusive. And that, in a particular way, is how we can get folk to know and understand that we must reconsider where we are in this particular historical moment.
We've got one last question, and Dr. Marshall, I'll ask you this. It's saying, how often do you think we'll need to be vaccinated after taking the initial vaccine? Is it going to be like the flu shot that, you know, you get your flu shot and your COVID shot every year, or do you know yet how often we'll have to take the vaccine?
This is actually an unknown. And so we don't know exactly how long the antibodies will last. I've had patients who've actually had COVID infections back in February, March, who are still positive with their antibodies, but that's totally anecdotal. That's not evidence-based. We need more research to determine how this is going to play out. But the key is now is getting the vaccine, and, you know, then we'll figure that out as we go along.
And we've got one last question. We've gone over just a little bit, but this is a question about underlying conditions. Is it true that the Pfizer COVID-19 vaccine helps those with multiple sclerosis? Does anyone have any insight on that?
So I'll answer that question, and I think what you're getting at, and so I'm going to answer the question very clearly. The answer to that is no. the Pfizer vaccine was not developed as an indication as a treatment for multiple sclerosis. So I want to start there. I also want to say in the trial of Pfizer with 40,000 people, those with multiple sclerosis were not excluded. So if you have multiple sclerosis, you can be included in this trial. The other thing that I will say is these vaccines are specifically for these populations with comorbidities, meaning you have chronic medical conditions that might impact how well you can fight off a virus or how well you can manage a complicated hospital course. And so if you have multiple sclerosis or other chronic conditions, you should absolutely consider taking this vaccine. The vaccine does not treat multiple sclerosis, but if you have multiple sclerosis or other conditions similar to that, it can protect you from the ravages of a disease that might be worse in someone who has a medical condition where their immune system or your health is already compromised.
I think the one thing that everyone can take away from this is that we've got to take it serious. You've got to believe the science, and you've got to get vaccinated. We've got to find a way to make sure that we are in that line or online or wherever we need to be so that we can make sure that we are vaccinated. And I think Councilwoman Gumbs is going to come back to close us out. Or
Yes, I'm here. That was actually amazing. So I do want to take a moment to thank you all. I learned a lot, and I hope our constituency learned a lot as well. I could not have asked for a better panel of experts to share this information with our community. So I just want to end again, like I said, I'm not feeling too well. So Michelle, I'm going to be calling and checking on you tomorrow.
Thank you.
But I just want to encourage our community again to be intentional, as Dr. Morgan said, about getting the facts. Don't allow JoJo and cousin Lulu and everybody else to say you shouldn't get the vaccine. Do your research, and you have a great panelist of people that you can always reach out to. I don't know. Do you all have pages or websites that they can get additional information?
Mm-hmm.
Kevin, you want to?
yeah, Dr. Wilson, do you want to share your website?
Yeah, my website is www.completelypsyched.com.
And Dr. Marshall?
Mine is mdforwomen.com.
And Dr. Hobson?
You can do www.mauricehobson.com or Google Maurice Hobson GSU. All of my stuff is there as well.
And Ms. Norris?
Yeah, at www.nationalchurchresidences.org, we have a COVID resource section.
And Dr. Jane Morgan?
You can find me on LinkedIn at Dr. Jane Morgan, Jayne Morgan. And I post all types of videos. I do something called the Stairwell Chronicles, where each day I take exactly 1 minute to answer a question about COVID. So if you have a minute of your time, you can listen to me answer a question each day for 1 minute regarding COVID. I have that on LinkedIn. I have it on some of my other personal profiles, but you can follow me on LinkedIn to see that.
Awesome. Well, thank you, Dr. Morgan. And again, Kipling, I can never do this without you. So thank you for the intriguing conversation. So I appreciate you all and your time to share with our community today. And again, I want to say to our residents here in the city of South Fulton, please, please, please consider getting vaccinated so we can begin to not necessarily get back to normal, but start moving things in the right direction. So again, thank you for your time and energy tonight, and I appreciate you. We'll be back soon with something else good to talk about. Thank you all.